Okay,
And welcome.
okay. Nito, Nito. Good evening, everyone. Michelle, actually, you started with the first part of the agenda by explaining to folks that um, Doc Jones had asked a couple of her more seasoned community members here to host tonight, talking about COVID and travel. Um, what we have here is a Michelle. If you can just display, just kind of, I know someone said they had to leave early. If you could display, just so that they get a sense, and then I guess you could email folks a copy of it. How do you normally do that?
Yes, I can send if they ask me,
Absolutely.
I can definitely send it. Let me see, where do I want to go here?
Okay. And while Michelle is, if you can just kind of scroll that, not the agenda, but the uh, presentation.
Oh,
Uh,
okay. I'm sorry, Dr. Kato. Hold on.
right. But what we'll be talking about tonight is travel protocol, biosafety travel protocol as it relates to COVID. And um, we'll be entertaining any questions that you guys might have. And Dr. Blessman has put together an outstanding piece in collaboration with Eddie Joe. So,
Oh, I didn't get it.
okay, so you do not have it.
No,
Okay.
she didn't send me that.
Yeah, I did. It's just, but what I'll do is I wanted to start us off with anybody anybody have any win-wins as it relates to COVID. Thank you everybody for being here. Do we have any win-wins as it relates to sharing the COVID protocol? I know that's something that Dr. Jones likes to do. I'm resending the document, Michelle.
Okay.
Do we have any win-wins?
I mean, I wouldn't say it's a win-win, but I mean, it's a win because I shared the skin guard or gave out a couple of the vials that I had to some family members and wind up ordering some more. So trying to get people protected and share what they need to have.
Okay, okay, that's great. Um, Well, hearing no others, one of the things that we had on the agenda was to entertain any discussion as it relates to our president getting COVID for a second time within a 48-hour time span. Does anybody have any comments on that?
I when you say 48 hours, I know he had it a couple of weeks ago. So I know he got it again. So when you say a 48-hour span, can you explain that?
He was diagnosed as negative, and within 48 hours, he was diagnosed as positive.
Well, then see, that's another issue I have because that could have been a false negative. That could have been a false reading. And sometimes when you test positive for COVID, and you go your 10, 14 days, it's not always out your system. So sometimes it takes a month, 2, 3 months before people even test positive. My job, when we were tracing, contact tracing, we had an issue with our union because the employees were out for 14 days and they constantly kept testing negative. Not all of them. They kept testing negative. I mean, positive. So sometimes you'll still test positive for a couple of months. So is it possible that he tested positive? I don't know. So I have a question. I got a pinhole on that one. And then I do know with the new, virus, since we have this B45 and the 2.7. I do know that you can get one version and turn around and get another strand. So how do we really know if they're not testing to find out what actual strand you have? So that could have been something with his testing. I don't know. I was curious about that one. I'm glad y'all brought it up. So I'd like to know y'all take on that one.
Well, my take is pretty much the same as yours. The first of all, this information is extremely um, the testing and the results have always been very non solid, for lack of a better word. They go, well, she may or may not have it. You can still get COVID after the vaccine, but for sure, it'll reduce your chance of, punching out of here. Um, None of it has been very rigid. My concern is, I would love to see our president wearing an ionizer. I think it's a very high probability that he is going to test positive again. And I think that it speaks to the lack of, we'll say, for again, for lack of a better word, there's still a high degree of um, ignorance as it relates to COVID, how it spread, how it works, etc. That's my take. Michelle?
I agree. I just think that has not cleared the virus.
Mm-hmm.
You
But then
know,
again, it's a two-way street. You're right. You can still, I remember Dr. Rollins saying, and I hear the people saying, just because you had COVID once doesn't mean you can't get it again. He told me specifically, you need to be very careful that you don't pick it up again because you can. So with this new variant, you're able to pick it up quick. I can see people getting it again twice, get one strand, think you heal, and you get another one because that one strand you had, um, it's not effective against the new strand that's even more stronger. So then it can hit your body again. The darn thing is so smart. I don't know. So that's a little nerve wracking to me because even with all the equipment that we use and we have, it's still a possibility. I have friends that say they wear their mask, they have an ionizer, but some people still getting COVID. So I don't know, but it's a little scary because you think you have all this stuff and you say that you assume that you're protected. It seems like that, but something can slip through because this virus is so smart.
Yes,
So
it
is
is.
there anything else that we need to be doing or in
I
addition
think
to what
we
we
did.
have
that's
already?
a good, Renee, one of the things that we have to um, understand is, first of all, like we had that whole discussion around our testing, right? So we don't have the best testing in the world when it comes to the masses, but he had some good testing, whatever test um, mechanisms that he uses, it identifies that he has COVID, where we can take these COVID tests, 2, 3, 4, 5 times. You get 3 negatives and 1 positive, but you had the symptoms the first 3 times that you took the test, and the first 3 times you took the test, they came back negative. But that fourth test was positive. He's getting um, the good test. So the virus stays in our system longer than, um, the 5 days that we're supposed to quarantine. In the beginning, we were supposed to quarantine, I think they said for 11, up to 11 to 14 days when, in the beginning when we were getting the
Mm-hmm.
contact tracing, like the
Yes.
contact tracing jobs, like all of the public health is okay. So if we go back 2 years, we can identify the epidemiologists, even though they didn't understand the virus, they understand public health policy. They understand public health framework. So you have these agencies prepared to take on the responsibility of tracing. I even went to the University of California at Los Angeles, UCLA, through their public health school and took 2 classes. They were offering certificates in being a contact tracer and being a case investigator. This is nothing that the government sanctioned. Most of these contact tracing jobs were coming from county, state health departments, and they were paying pretty good. They rolled those contact tracing positions out vigorously. And then they started to dwindle because they were not being financially backed by the government. So part of that contact tracing was what? Go back to the people that you know, who were you in contact with within the 5 days, or 10 days. Then they get the social determinants. Who do you live with? Can you get some food? Right?
Right.
But yeah, Miss Wright, Trump made it political. And he made it, there was so many different discourses coming from the White House, the media. Your doctor didn't know what it was. People going into the hospital dying. We experienced they were doing that monoclonal treatment with Black people before we even knew that Black people were the greatest at risk for the virus, right? So all of these things were happening at one time, and no one got a handle. Whatever it is.
Recording in progress. One of the things that I wanted to